This is the area which was covered using the scalp and the beard hair. Right, this is just the fourth day. You don't get any mark. No wound is there. 2200 grafts were taken from here, and you can see the hairs are still there. They are growing, and it looks that nothing has been taken, and there is no mark. There is no redness, there is no edema, nothing is there, there is no wound. So the beard looks as normal, and somebody wants, he can shave on the next day. Yes, dear. So how are you?
I'm feeling very good.
So what has been done with you?
So on the 6th and 7th, we did the hair transplant from the back of the head and my beard area. This is the fourth day I've been here, washing my head with just plain water. The wounds are healing. Still a little bit sensitive when I touch, but the redness is gone. Feeling good. Going back to home tomorrow.
So how was your on first day of hair transplant?
The first day, for the whole day, because of the anesthesia, the pain was very less. But when I went home, I was able to sleep straight on my head. The pain there was a little bit of swelling, not much. The pain probably from a scale of 1 to 10 was 3. So I felt good.
So previously you must have thought there will be a lot of pain.
That is true, and that's why I was postponing this. But I heard a reference from a good friend of mine, and he gave me good advice, and that's why I was here.
Could you give some message to those who are worried about the pain and they are postponing their hair transplant? Because we also see a lot of patients, they come with anxiety that they will have a lot of pain, and when they undergo hair transplant and they find there is no pain, and they think that I should have got it done long back. So what message you would like to see those who are watching this video?
I think what I have seen is personally for me, I have been thinking about this for no less than 3 years, and I was not ready to jump in it, probably because of the pain reason. But when I talk to my friends, the technology has advanced so much that it's really, you can go in the morning, come out and go back to work the next day if you really need to. In my case, I was here at home on vacation, so I didn't have to go to work. But I guess for those, stop trying to do too much research, because the more you read about it, the more anxiety you have. Find the right person, talk to the references. This is one of the best practices in India. Probably I would say within the US too. The staff is excellent. All you gotta do is look at some of the work Dr. Garg has done, see what their patients are going through, but you just have to go through this because it's 2 days, 1 to 2 days, depending on your donor area and the size of the number of grafts you have to enter. But I would say jump into this, because for 3 years I had waited, and now it's been a week, and
So-
I've started feeling pretty good.
You stay in US.
Yes, I
And you got your hair transplant done in India.
That's true, and I didn't plan for this. So when I came here 2 weeks back, I had no intent of doing this. But when I talked to my friend and I talked to Dr. Garg, he was able to accommodate, and I just said, let's get it done. Because the more you think, the more you're going to have anxiety, and there is really no need to worry. I did not see, the staff is excellent, so that is very important, because they will make sure that you are getting the best service, and if there is pain, they stop the procedure and make sure that they are addressing any pain or issues, and then they get back to work. So you just have to come here, relax, get it done, and just give it a few days for it to heal, and then the week after get back to work.
So if you compare few places in US and you got it done in India, that too in Indore, which is a mid-cap city, so the ambience, the cleanliness, hygiene and all that, people think that India is not that clean and hospitals are not that clean. So just give me your pure opinion that how you feel that how this center level was as far as the hygiene, cleanliness, and all are concerned.
So, talking about my opinion, even within India, my belief before coming to Indore was, hey, the only place where you can get good treatment is probably Bombay or major metros. That's why for 3 years I was talking to my friends, hey, where should I get it done, Bangalore or Bombay? Um, and that's why it never got done, because over there, how do you schedule, and you don't really have references of people to talk to. Then I came here, and what I saw here is good stuff. The level of cleanliness is pretty amazing. The detail level with which they give us instructions, it's pretty amazing. So I would say what I saw here, the quality of care is as good as what I have seen in US. Probably
Oh, that's great.
probably a little bit better, because the staff really takes care of you, which you don't really see outside. And so each and every individual is vested in you. They're looking after you and making sure that you feel good. They give you a call the night of the surgery as well as the morning after, and the doctor is
Oh,
always
do they
available.
call from the center?
Yes, they do.
Okay, okay.
And so thankfully I didn't really have too much to talk about, because I was feeling good. But in case people have issues, they are there to address any concerns. So that is the good part. What I would recommend is, it's trying to go after going towards big cities. That's a big unknown. Indore has grown a lot in the last 20 years, and this is one of the best practices out there, I would say. And this is based on my experience and what I have talked to my friends. Everyone I have talked to really feels good about what Dr. Garg and his staff has done. And I do feel good. It's
You
been-
saw there were the two doctors who were harvesting.
That's
on
true.
your-
Dr. Garg and Mrs. Garg were there harvesting from the back of the head, each side, as well as from the beard area, and they were very careful.
And they reduced the time of your harvesting.
That's true.
So because two persons are harvesting, so certainly on table time for a patient is half than the usual, because probably this is one of the rarest center where the two surgeons of equal competence are harvesting. So 5,000 grafts were put in 2 days and covered your entire head.
That's true.
So-
About 5,500 grafts were there,
55.
somewhere around that. So I feel good.
Oh, thank you so nice of you, my dear.
Thank you very
Thank
much.
you very much. Thank you.